We're very fortunate to have Dr. Brian Andrews to have an interview with us. He has been a neurosurgeon for several decades in San Francisco and has established very well. And I would like to talk to him today for the first time so he can tell us about his career.
Okay, well, I was interested in medicine from a very early age, but did not have a particular interest in the neurosciences. During medical school, I was lucky enough to go to UCSF. I very much loved neuroanatomy, and then I found out I liked to dissect with my hands. The basic anatomy was a great place to learn that I liked using my hands. I was musical as a kid, and a lot of times that translates into surgical comfort. So I kind of gravitated towards the nervous system and dissection and surgery, and met up with some neurosurgical residents at UCSF, which happened to have a great program, a world-class program at the time, in the late 70s, early 80s, and so I gravitated towards neurological surgery. Now that's a field that is unique in the sense that it takes care of the brain and the skull, kind of the nervous system and its coverings. So it's the skull, the brain, the spinal cord, the nerve roots, the spine itself, the peripheral nerves. All of these are really within the realm of neurological surgery. So we learned that over the course of about 6 years of training. Some of it's research, much of it's hands-on. And then I went into practice in San Francisco at the Trauma Center, which is a place a lot of young neurosurgeons start at. San Francisco General is a great trauma center, and I was there for several years, initially practicing and then later teaching for many years. And then I've been in practice in San Francisco doing neurological surgery for about 33 years. And that's been primarily at the hospital I work at, California Pacific Medical Center.
Now, I realize you're also doing, heading a department at the California Pacific Medical Center. And are there anything else that you do on the side? Are you doing any, either research or public, facilitating the public in terms of teaching or?
So the teaching I do has to do with training the interns and residents at our facility. I do chair the department of neurologists and neurosurgeons, and we provide lots of conferences, educational conferences once a week in some field of ours or another, and that goes out to mostly physicians, not so much the general public. We have done conferences for the public in areas like spine health over the years. Once a year or so we will do something along the lines of spine health. I've written books, primarily, at first they were texts for doctors. Later I did a biography of my mentor, Dr. Charles Wilson, which came out a few years ago for general consumption. A lot of my patients like to read that book because it kind of talks about my beginnings and the field I'm in. So those are the main things I've done within the field other than my private interests.